Welcome to this dietary video for the management of gestational diabetes. My name is Naomi, and over the next 30 minutes I will talk you through the key dietary tips to keeping your blood glucose levels well managed while ensuring a good, balanced diet for you and your baby. All the information covered is summarised in your Gestational Diabetes Dietary Booklet. Gestational diabetes is diabetes developed during pregnancy only. When we eat carbohydrate foods such as bread, rice, biscuits and fruit, they are broken down through digestion and release glucose, a type of sugar, into the blood. We produce a hormone called insulin, which is important for blood glucose regulation. Insulin acts as a key to open your body cell doors, allowing glucose to leave the blood and enter body cells, where it is used for energy or it is stored. Hormones produced by the placenta reduce the effectiveness of the insulin. When the insulin is not opening the body cell doors well enough, blood glucose levels can stay too high for too long. Your diabetes midwife will have discussed the importance of keeping your blood glucose levels within the healthy range to avoid risks to you and your baby. The first-line management for gestational diabetes is through diet and lifestyle. For some women, they may also require metformin tablets, which improve sensitivity to insulin in your body. Some women may also require extra insulin in an injection form. You have been advised to test your blood glucose levels 4 times per day. When you wake up and before you eat breakfast, the blood glucose target level is 5.3 millimoles per litre or less. And 1 hour after each of your main meals, and the blood glucose target level is 7.8 millimoles per litre or less. We will now discuss dietary tips to help you to keep your blood glucose levels within the healthy targets. Carbohydrates can be found in nearly every food group within our diet. It is the overall term given to the different types of sugars in the diet. We need carbohydrates for energy. Starchy carbohydrates can be found in staple foods such as flour, bread, chapatis, pasta, breakfast cereals, rice, and potatoes. Natural sugars can be found in dairy products and include milk and yogurts, and also natural sugar found in fruits. And lastly, added sugars can be found in many foods. These can include table sugar in drinks, syrups, biscuits, chocolate, fizzy drinks, and sweets. Eating a large portion of carbohydrate foods can be harder for your body to manage. This can cause your blood glucose levels to stay too high for too long. Too much carbohydrate can also lead to weight gain, a risk factor for type 2 diabetes. Try to space your carbohydrates out into 3 meals per day. The speed at which a food breaks down and raises blood glucose levels is called the glycemic index, or GI for short. Low GI foods raise blood glucose levels slowly. For example, a food with more fibre in it, such as granary bread. This takes longer to digest and causes a small rise in blood glucose levels over 1 to 2 hours. A high GI food raises blood glucose levels quickly. Typically, these foods are more processed, such as white bread or breakfast cereals. These can raise the blood glucose levels quickly within 1 hour. Examples of high GI foods include white bread, long grain white rice, white flour and white chapatis, cornflakes, Rice Krispies, and most sugar-coated breakfast cereals, Weetabix, rice cakes, baguettes, jacket potatoes and mashed potatoes. Some lower GI foods include granary or whole grain and rye breads, most fruits and vegetables, brown pasta, egg or whole wheat noodles, chapatis made with wholemeal or multigrain flour, rye crackers, new potatoes, sweet potatoes and yam, brown and basmati rice, and porridge oats, as well as lentils and chickpeas. Try to choose more of the lower GI foods in your meals. If you are increasing your fibre intake, remember to drink enough fluid to prevent constipation. Eating large amounts of low GI foods can still cause a high blood glucose level. Try to keep the amount of carbohydrate in a meal to around a quarter of the plate. This is approximately 30 to 45 grams of total carbohydrate. Many people use their fist as a rough guide for this portion. For example, this could be 3 to 4 medium new potatoes, 3 to 4 tablespoons of rice or pasta, 2 pieces of granary bread, or 1 small thin chapati. The rest of the meal we advise to be made up of half a plate of salad and vegetables, and a quarter of the plate left for some lean protein such as meat, fish, eggs and tofu. If you use pulses such as lentils or chickpeas in meals, these do count as a protein portion too. However, they also contain some starchy carbohydrate, so be careful to keep any additional carbohydrate in the meal, such as chapati or rice, portions smaller. The pulses have lots of fibre and digest slowly, which is helpful for blood glucose control. Similarly, be careful to reduce the amount of potato in curries or stews and limit intake of potato stuffed parathas, samosas or dumplings. Here we have some examples of how to rebalance the carbohydrate in meals. A jacket potato with baked beans and cheese, which has 90 grams of carbohydrate, can be swapped for a smaller potato with tuna and salad, which has 50 grams of carbohydrate. A breaded piece of fish with mashed potato, which has 75 grams of carbohydrate, can be swapped for a plain fish with new potatoes and salad, which has 35 grams of carbohydrate. A large lentil dal and 2 chapati, which has 100 grams of carbohydrate, can be swapped for a small portion of dal with 1 thin chapati and extra salad. This has 45 grams of carbohydrate. Or a large portion of rice with chicken, which has 70 grams of carbohydrate, can be swapped for a portion of a quarter plate rice with chicken and vegetables, which has 40 grams of carbohydrate. It can be helpful to read how much carbohydrate there is in your food on the food label. To find this out, you will need to look for the total carbohydrate on the label. For example, this sliced whole grain bread. Per 1 slice of bread, there is 15 grams of carbohydrate. There is very little added or natural sugars in the bread. Therefore, the of which sugars written underneath is near to 0 grams. Another label shows cornflakes cereal. This shows that in a 30-gram portion of cornflakes, there is 25 grams of carbohydrate in total, and 2.5 grams of this is simple sugars. To know if the simple sugars are from a natural source, such as fruit or milk, or if they are added sugar, the ingredients list is helpful to look at. The ingredients list shows that this is added sugar in the cornflakes. We can compare the of which sugars per 100 grams to see if it is a high, medium, or low amount. Per 100 grams in the cornflakes, there is 8 grams of sugar. A low sugar product should be less than 5 grams per 100. The cornflakes fall into the medium sugar category. Use the food label guide included in your booklet to check your food labels at home. A helpful guide to total carbohydrate portion is the Carbs and Cows book or app. Fruit and vegetables are a very good source of many important vitamins and minerals that we need in our diet. It is recommended to have 5 portions of fruit and vegetables a day. Fruits contain natural sugar, therefore we advise keeping fruit intake around 2 to 3 well-spaced portions a day. A portion of fruit is 1 medium fruit such as 1 apple, orange, peach or pear, 2 smaller fruits such as plums, kiwis or satsumas, a handful of berries or around 7 strawberries, 1 to 2 thin slices of pineapple or melon, half a small avocado, or 2 to 3 dates or dried apricots, or 1 tablespoon of raisins. Try to opt for lower sugar fruits such as strawberries, blueberries, and raspberries. Tropical fruits are often higher in sugar content, therefore a portion is smaller. For example, 2 slices of mango, just 10 grapes, or a small children's-sized banana. Watermelon tends to digest very quickly, making it high GI. We therefore advise a portion is just 1 slice or 150 grams. To ensure you meet your 5 a day, try to include plenty of vegetables and salads with your meals. 1 portion of vegetables is around 80 grams or 3 heaped tablespoons of cooked vegetables. For example, peas, ackee, broccoli, carrots, and pulses. Remember to include different vegetables for a range of vitamins and aim for half of your plate. Green and leafy vegetables are particularly high in folate. Dairy is important as it provides us with calcium, which is important for bone development and strength. It is recommended to consume around 3 portions of dairy each day. This could be 25 grams of cheese. Try to opt for a reduced fat cheese or a lighter cheese such as cream cheese or cottage cheese. During pregnancy, avoid mouldy and blue vein cheeses. 200 ml of milk. Try to opt for semi-skimmed or skimmed milk. If you are drinking a milk alternative, opt for the unsweetened variety and ensure it is fortified with calcium. Or 125 grams of a yogurt. Try to choose a plain, natural or Greek-style yogurt, which is the lowest in sugar. We will now talk about fats. A diet high in fat and carbohydrates can cause weight gain. Typically, a lot of fast foods and processed foods are high in both. Try to reduce your consumption of processed foods, deep fat fried foods, and takeaways. Choosing healthy fats, also known as unsaturated fats, can have a benefit for your heart health and cholesterol levels. Examples include avocados, for example spread on bread or chopped up into salads. Some nuts such as almonds, Brazil nuts and walnuts. A handful of unsalted nuts make a really good low carbohydrate snack. Oily fish such as salmon, mackerel and sardines. Aim to have no more than 2 120-gram portions of oily fish per week during pregnancy. Or olive or rapeseed oil. You could use 2 to 3 teaspoons of these oils in cooking or on salads. To reduce overall amount of fat used in cooking, try to fry less often and avoid using extra butters or ghees in your meals. Try to do more boiling, steaming, poaching, dry baking, using 1-calorie spray oil, grilling, and removing visible fat from meat. Remember to always ensure food is fully cooked. Snacks should be limited and taken only if you are hungry or have been advised to. The Gestational Diabetes Dietary Booklet shows some good examples of lower carbohydrate and more nutritious snack ideas if you do get hungry. Try to limit to no more than 1 snack between each meal or before bed. Some examples include cream cheese on 1 whole grain rye crisp bread, sugar-free jelly made with water or a diet lemonade, a handful of plain nuts, a Greek yogurt with a handful of berries. Water is the best fluid to be drinking throughout the day. We strongly recommend to avoid drinking any sugar-containing fizzy drinks or squashes. However, you can swap to the sugar-free varieties. Try to avoid making smoothies or fruit juices which contain more than 1 portion of fruit. These drinks will raise blood glucose levels very quickly. You can see here that there are 6.5 sugar cubes in this 300 ml glass of orange juice. And there are 7 sugar cubes in this 250 ml smoothie. If you drink tea and coffee with sugar, it is recommended that you cut this out. If you are struggling to stop sugar, you can try a sugar-free sweetener. A list of recommended sweeteners are in your booklet. These will not raise your blood glucose levels. Remember, brown sugar, honey, and syrups will all still raise your blood glucose levels, and they are not suitable alternatives. Lastly, milk can be a nutritious drink. Try to keep it to 1 small glass per time. Avoid making milkshakes. Remember to keep your fruit whole and separate as a snack. If you are making lassi to drink, opt for a plainer version using natural yogurt and water. There are some very important vitamins advised for a healthy pregnancy. Vitamin D is advised for all pregnant women and when breastfeeding. A daily supplement of 10 micrograms or 400 international units is advised per day. This is contained in most pregnancy multivitamins. If, however, you have a deficiency, your doctor will advise a higher dose. The main source of vitamin D is through safe sun exposure. Folic acid, 400 micrograms, is advised per day, pre-conception, and for the first trimester of your pregnancy. You can also gain folate through eating dark green and leafy vegetables such as spinach, kale, cabbage, broccoli, peas, and pulses, as well as oranges and some fortified cereals. B12 deficiency can cause tiredness and nerve damage. B12 is a vitamin gained through eating animal products such as meat, fish, and eggs. It is also added to some milk alternatives and vegan meat foods, breakfast cereals, and Marmite. If you are vegetarian, you may be at more risk of B12 deficiency. Your doctor may prescribe you tablets or injections to treat a deficiency. And iron. Meat, in particular red meat, is a rich source of iron. Vegetarian sources of iron include chickpeas, nuts including Brazil, hazelnuts and almonds, sunflower and sesame seeds, spinach, and broccoli. Physical activity has many benefits, including helping us to maintain a healthy weight, lifting our mood, and improving blood glucose levels. Being active after you eat will help to bring blood glucose levels back down. Aim to be active for at least 15 to 30 minutes after your meals. And aim for at least 30 minutes of moderate intensity activity 5 times a week. Moderate intensity activity includes any activity that raises your heart rate, makes you breathe faster and feel warmer. Here are some examples. Brisk walking, jogging or running, water aerobics or swimming, playing badminton, dancing, pushing a lawnmower, or pushing a pram uphill. Remember to build exercise up gradually. Some exercise is better than none, and every minute counts. Always consult with your doctor before taking up a new exercise. If you are taking insulin injections, please discuss what your exercise plans are with your diabetes team. Gestational diabetes will usually disappear after your pregnancy. However, some studies have shown around 50% of women who had gestational diabetes may go on to develop type 2 diabetes within 5 years. To reduce the risk of this happening, it is important to continue to follow a healthy and balanced diet, as well as leading an active lifestyle long term. Body weight is a very important risk factor for type 2 diabetes. Aim to get back to your healthy BMI after your pregnancy. You can plot your weight and BMI on the chart in your dietary booklet. Breastfeeding can help towards weight loss by using up extra calories, as well as being beneficial to your baby. We hope you have found this video helpful. For further dietary support, please contact your diabetes dietitian or ask to speak to the dietitian at your next clinic appointment.